Hi there, science fans. I had convinced myself that upon distribution of the various vaccines, no more of my COVID YouTube videos would be necessary, and I could develop new videos describing new personal medicine tools like cancer immunotherapy and the wonder drug CRISPR, as well as other drugs that are in the research pipeline. However, I feel compelled to produce the present video that hopefully debunks the vaccine myths that are circulating on the various social media platforms. This slide shows the most prominent myths that are being falsely distributed on social media platforms and on some right-wing media. I will take on each bullet point one at a time. Although it is true that COVID-19 vaccine was developed rapidly, messenger RNA vaccines have been under development and use in humans for at least a decade. Some of these vaccines have been successfully used to fight blood cancers and are now being modified for application against solid tumors. RNA technology has been available for more than 50 years. It seems new because the COVID-19 virus is new. As far as testing, these vaccines were tested in humans in a similar design as any other drug that is developed for use in humans. The main difference is that the data reported to the FDA are reported in real time and not after all of the experimental data had been compiled and provided to the FDA in their typical format. Additionally, since the vaccines have been given to millions of humans worldwide and any adverse events are reported in real time, one can argue that the number of humans exposed to the vaccines are unprecedented and the adverse events are very low. Having been affected by COVID does not necessarily mean that the antibodies generated can protect against new variants or mutants of COVID like the highly infectious Delta variant. In fact, a recent scientific paper published in the prestigious journal Nature provides incontrovertible evidence that humans infected by the original alpha COVID virus are not protected from infection by the Delta variant. So it would be prudent to get the vaccines since the Pfizer, Moderna, and J&J vaccines have been shown to protect against hospitalization and death resulting from Delta infection. Are there severe side effects associated with the vaccine? In the majority of individuals, the side effects generally include soreness at the injection site due to the body's inflammatory response to the injected vaccine, malaise or fatigue, and in some cases development of a transient low fever. As with any drug given to millions of people, some genetically compromised individuals may have a more severe response. Those individuals with compromised immune systems fall into that group. There are no data that suggest that women or men will become infertile or that the vaccine is a teratogen that affects the in utero development of the fetus. Does the COVID messenger RNA alter my DNA? The messenger RNA was constructed or engineered in such a way that its only function is to serve as the blueprint to make the COVID-19 spike protein that triggers the immune response. The messenger RNA cannot interact or do anything to the DNA, and it is degraded after the instructions have been used to make the protein. This vaccine is very well characterized and does not contain eggs for those who may have allergic reactions to eggs, or it does not contain fetal tissue. The Moderna and Pfizer vaccines contain a nucleoside-modified messenger RNA that only encodes for the SARS-CoV-2 spike protein. A few salts, some fatty acids and preservatives, and a lipid nanoparticle that acts as a protectant and a carrier for the vaccine. Some rare individuals may be allergic to some of the organic components of the mixture, and that is why one is encouraged to remain after vaccination for 30 minutes for observation. As for the last bullet point, there is no microchip in the vaccine, period. You can read through these verifiable truths and come to your own conclusions. These responses are the results of the virus mutating to a Delta variant causing infections, sickness, hospitalization, and in some cases death. More than 97% of new hospitalizations are in unvaccinated people, and about 99% of recent deaths occur in unvaccinated people. So get vaccinated. Vaccinations will not only save your life, but also prevent you from becoming an incubator for further mutations of the Delta virus to a new variant. A new variant could make present vaccines moot and require booster shots for all those who are vaccinated.